Dr. Jennifer Miles Thomas, Vice Chair of Regional Integration and Innovation in the Department of Urology here at Northwestern Medicine. Healthcare disparities are throughout all systems, regardless of health system, private practice. It's what we're seeing in America. And healthcare integration is one of the ways that we can help overcome it. Northwestern Medicine definitely has been on the forefront of integration. We take a very different approach to patient care. So we are always focused on the right patient is in the right location and seeing the right provider. There are many barriers with integration. The largest one is communication, and the other one is time. And Northwestern has been exceptional with developing processes and programs to overcome them. One has been the implementation of Epic. We no longer have to consider different EMRs at different hospitals. It's the same instance across the entire system. It's very difficult for patients to navigate these complex systems, but what we have focused on is really the patient and how to help them move through the system in a well-integrated fashion. After COVID, a lot of things moved online, so it makes it much easier to communicate and collaborate. Everyone on the same Teams meeting at the same time to help coordinate the care, so we can review difficult cases with ease and efficiency. We have a growth and innovation committee where everyone from the regions can talk about what's new in the field, what do we need to bring into Northwestern, and how do we coordinate moving that through and delivering that care to our patients. The main issue is that a lot of times with disparities, there's a disparity in education, access, communication, and if you can integrate the delivery of care, it makes the world of difference. Those patients aren't now challenged with integrating or understanding how their healthcare journey should happen through multiple different languages, multiple different sites with different levels of severity. And so if you integrate the process for patients, it makes it much more streamlined. Patients can now follow the path. They feel like they're guided. They have a lot more support. I transitioned from a large private practice to a very large health system. The intent is exactly the same. And as you learn to scale some of the processes and procedures, you understand at the end of the day, healthcare is just people. Once you can deliver care to people, everything is about the same. What excites me about Northwestern's approach to integration, it's that the desire to remove these silos is key for healthcare. And the fact that Northwestern is thinking about this and trying to put together programs, processes, and people in order to provide seamless care is exceptional. If you put the patient first and then you understand their journey, it has to be integrated. Right now in medical school, we really don't have conversations about the business in medicine, part because of the sheer volume of information we have to learn to make sure that we're providing adequate care. But once you get out and you finish your residency, you are thrown into a completely different business world where a lot of times you really don't understand what's happening or why it happens. And in order to deliver truly exceptional care, you need to understand the front and the back of the system. And so I obtained my MBA because I wanted to speak the same language. I wanted to understand what's going on in healthcare, but I really also wanted to understand what's going on outside of healthcare. We've been doing the same thing for a very long time. And we're slow to change, not because of a desire, but because of the risk that's involved. And so the more that we can learn how other industries manage risk, we can bring to our systems and help create change.